Hi there. Are you missing a tooth? Okay, don't scroll. Hold on. I'm Dr. Nduka Chidinma, and today I'll be talking to you about options you can use to replace your missing tooth. Okay, so stay tuned. Watch till the end. Number three will definitely be a game changer. So watch till the end. A missing tooth isn't just about the looks. Okay, it can affect how you chew, how you speak, your self-esteem. Okay, and your jawbones, okay, even your facial contour. Okay, if you notice, there's some people that when they lose, let's say, their entire teeth, you notice that their face begins to sag, like it begins to drop. Okay, that's what happens whenever you lose a tooth. Okay, so you're not supposed to just leave your tooth just like that. So for those people that are missing a tooth, okay, or multiple teeth, okay, number one option can be for you to get what we call partial dentures. Okay, so this is a picture, by the way. So now the problem is the partial dentures, it replaces multiple teeth. Yes, good. But now the downside of it is that over time it can lead to bone resorption. Okay, so meaning the bone or the area where um the denture is replacing over time reduces in height and in weight. Okay. So that's the downside of partial dentures. The partial dentures, it can be made of acrylic, it can be a flexible denture, okay, it can be a complete denture. Okay. So those are for dentures. It's one option. The second option can be for you to get what we call dental bridges. Okay. This is an example, by the way. So now for dental bridges, it has less tissue coverage. Okay. Although it can be time and cost intensive. Okay. And not just that, it's more difficult to, you know, to repair whenever it's damaged. Okay. But now the downside of bridges is that you most likely have to damage two healthy teeth, two healthy adjacent teeth. Okay. That can form as a support for that bridge. Okay, so let's go back. Number one, we talked about dentures. Number two, we talked about dental bridges. And then the third one is dental implants. So now this is the gold standard. This is a picture, by the way. So now for dental implants, it's not something you just do at a go. Okay, dental implants can take like 4 to 6 months. Okay, so now another thing is that it's not everybody that is fit for an implant placement. Okay, so you meet your dentist, and then your dentist would assess if you're a good fit or not. Okay, so for implants, this is a picture, by the way. This is how it looks. And what happens is that when you're a fit, when you're a good fit for the implants, you come in, we drill your bone. Okay, so it's a surgical procedure. We drill the bone, we sink in the implant, okay, and then wait for like 3 4 months for the implant to take. Okay, so after that you come back, we put what we call an abutment. Okay, so after the abutment, we now put the crown on that abutment. So it's more like a permanent upgrade. Okay, it's not something you can take out. It's just there. It's there. You as the patient, you can't remove it. Okay. So and obviously when you're getting an implant, like I said, is the gold standard, right? So when you're getting your implant, there's some things you're supposed to do so that your implant doesn't fail. Okay. And not just that, another option is for you to decide to do nothing. So I've had a lot of patients come in and then they have missing tooth, okay, like they've extracted or something, right? And then you tell them that, why don't you want to replace your missing teeth and everything? They're like, no, I don't want to replace it. I like it the way it is. Guess what? Nature naturally aborts vacuum, right? So once there's a space somewhere, the two teeth beside that space, okay, they shift, okay, and as they are shifting, the space is closing, right? And even before that space closes, the tooth up will be growing downwards into that space. Okay, so at the end of the day, there's a malocclusion. Okay, like the whole teeth, they're all scattering because of that single space that has been formed. So that's why we always advise patients that please, whenever you extract a tooth or something, if you cannot get immediate dentures, okay, you can just try your best to either you get them. So yes, so tell me, Which of the following options would you like to go for? Leave me a comment. Thank you. And also send this to people that you know that have missing tooth. It can be the front teeth, it can be in between, So just send this video across. Thank you.